Hey, Lady DSTV, I missed you on my last live stream. I was like looking for you. I didn't see you. Thank you, Bola Steve. Thank you for coming. God bless you. Thank you for coming. Alpha Joy, thank you for coming. I wanted to play some music, you know. Alpha Joy, thank you. Hey, I'll be here. Hey. Lady DSI, look, take it away. Take it away. Thank you guys for coming. I wanted to play some music. Please share me out if you can, so it will be much on the broadcast. Thank you all for coming. Thank you. I was not okay. You traveled. Me too. I traveled. I went to UK. You know. I when I came, I did one live stream. I didn't see you. I was like, oh, well, Lady DS. 3-4 days ago too. I came here. I didn't see you. Hope everything is cool. Bola Steve, thank you for coming. God bless you. Alpha Joy. Mwah, mwah, mwah. If you know you can share me out, please do. Thank you, Bola Steve, for sharing me out. God bless you. So will be much. You are going to dig it. You are going to explore. We are going to, hey, God, do make one this thing. Thank you for sharing me out. Thank you very much. You know, we don't learn. We don't really learn. You know, I came across a lady today with big sore, big injury. You know, for kpekus. Wetin he go do? He want tighten kpekus. So I want us to come and learn different things today. And so the VJJ go be for the rest of his life, because the doctor said they cannot do anything about it again. You know, at times when I talk on my channel here, people go dey think say, wetin this woman dey talk, wetin she dey talk. I know wetin I dey talk. I dey stress am all the time here. You know, I dey stress am all the time here. You know, there are some certain things where be say, if you see one person talk am, second person talk am, third person talk am, you go come see say little fat don dey for that thing, since everybody is like saying it. I don't know if you get, but by the time only you hosts go to my community to see what I wrote. Wetin you write again? I don't start to. Let me go and see what Bola wrote about me. Bola no be no be Kokumba and Kpekusi go right there today. Hey, what I will do you, that's all you wrote. You see what you'll see wetin I go do you now. Let me check. Bola's tip. That's wetin I content. Even Lady DS. Now wetin she say dey describe me be that. I go say I no blame una. I love you all. No say I love una. I heart all my subscribers. Let me check what this lady wrote. Roller's tip. The way I even take bring tongue out, e reach when I go take write something. Bola's tips. Okay. Where is our community? Join in, get some tips. Okay. Tips for waiting. Yes, so we need to be learning every day. That is it, you know. Let me off my Bluetooth because I wanted to I wanted to you see, at times when I will be telling people, be mindful of the way you treat your kpekus. Be mindful of what you insert there. People go think say maybe. Please hold on. Abiobola, na engine house, you know. She went to watch one lady. I don't want to mention the lady's name because make anybody not feel say they want use me trend though. They want use me trend though. I want to trend on my own. When God say I want take trend, I want take and trend. She was teaching how you can use garlic to wash your kpekus. She told them to put needle, clean needle, make them use and take. We don't have to put anything there. May I just explain to you, my darling sister, Lady DSTV. She come say make them insert, make them use needle, clean needle. She was explaining it as if she was an expert. Make them use clean needle, put hole for the garlic. Then where me know say that they put garlic na anus. I still dey talk am here for my LS. So he can't tell this woman, una know say that Allah sign that is in okay, you know the person. I no wan mention name. Make they don't say Susanne Baptist. She never grow. She dey find who she want to grow a hair. Not being the lady go put oh my God, people are desperate. Yeah, she won't tighten her vagina, and that will not even tighten your vagina. I don't know if you understand. That allies in that chemical that is in garlic is very, very hot. It can't do finish. It can't melt that woman's vagina. It can't melt her vagina. Her vagina is now smelling. They cannot sew it. They cannot treat it because the thing is just melting out. Doctor said there is nothing they can do for her vagina. Okay, you know the person. Mo no mention name before they go say we won't use the trend. And you know I don't like Sandra. It don't spoil Nabola still. It don't spoil. She just damaged and now she is infected because that thing is very, very hot. If you've eaten garlic raw, you will know what I'm saying. Then you go come insert them there. Maybe for this her case, and I was just going through her comment section. She don't they come back and answer questions when they which you go don't put video down. People will go there and be asking you questions. You don't go back to give them feedback. That one alone don't mean say you are misleading people. No matter how my messages go many reach, I answer everybody. If it take time, I feel no answer or finish. But the following day, 2 days, 3 days, you must see me say I answer you. Okay, you don't tell them say they should do this thing. And when they finish doing it, what you will now do? You will ignore them. Maybe they don't fight with what you say make them go do. I don't know if you guys get. We should learn to read about things. When somebody said go and insert this, that, even me we talk and say go insert garlic for your anus. Go read them. It good? Garlic water for anus for pie. Is it good? Read it. Those people we do the research, we say those properties, they're very, very good. They will tell you, yes, it's good. Then you go come blend down. Which kind bad something come dey your kpekus wey you want kill by all means with garlic water as that thing harsh reach? Yeah, it's ignorant. It's ignorant. Now she's not treating her kpekus because there is a very big injury there. She know the waka well. Okay, now who ikpekus no get injury, no dey fit even F well, no talk of now be say effing is over. That day she was serious about it. At first I thought she was joking. When I saw it, things like that irritates me. So I don't even stay. I saw it, I was like, what is all this? All in the name of view. And you know, all those gullible followers, they would think she's saying the right thing and they would just go and be doing it. I saw another concoction the person prepared. And I was like, what? Adding two things, we get the same properties. So make they take and cure one thing. And that thing that you're asking them to cure with that same property, those things can be too much for that thing. He go even fit give you a stomach ulcer. But she didn't explain it. She just put them out there for them. I pity the lady. My mind was like, hey, God, though, as cucumber sweet rich now, this woman not go do again. Because once doctor don't reject you, say there is nothing they can do about your cucumber, there is nothing they can do about it. How on earth, out there you will go and be using garlic to kill a infection in your vagina? At times, Bola's tip, Lady DS, I don't even know who is there. If you don't talk, I will not know who is there. Just type something so I will know who is watching me. You understand? I don't understand. I don't know why people are like this. I don't know why. I don't know how I want to shout it. There are some certain things they will put out there. Those things will be detrimental to your health. They will not want to know. All they care about is make I do this thing, make I do this thing. And when you go, don't do any repercussion. That thing that you are even doing, if it even make your situation worse, or if it even can give you more sickness. Wait till they make us when you want tight. My people does not know that as we have bad bacteria, we also have good bacteria. You know, the way they will just hear bacteria, they just feel say bacteria bad. There are some bacteria that if our body no get them, it no go function well. I don't know if you guys get. It will function well. So if you want to kill bacteria, know the bacteria you want to kill. By the time you are fighting the bad bacteria in your vagina, you are killing the good ones. By so doing, you are exposing your kpekus to different things. I don't know how else they want me to say it. I don't know how. And some people will still come and will be arguing with me on my comment section. I don't come back again. I've been away for a month now. From next week, Monday, I'll start doing my video properly the way I've been doing it. They will still come to my comment section to be arguing with me. Madam, you go talk this one. Madam, you go talk this one. I say it all the time. Anything I say on my live stream, I go to the researcher desk. I will bring it and I will tell you, this is how it's supposed to be. This is how it's supposed to be. But before you do it, still go and do your research. You see some people, they will bring this thing. They will say, this thing, just drink it overnight. You will see what will happen to you the following day. Now magic. It doesn't work like that. And you will see people jumping into it, doing it. Or they will tell you, drink this thing overnight, your bola go come be like this. My God. Bola we don't die. You need time to get up. I don't talk say you no go get up. You need time to get up. You need time for all those arteries that is carrying blood to your penis level. You need time to get there. You need time for all those this thing where they carry blood to the Ebola region to take reach there, make it for strong. No, they will just say you drink this overnight, your Ebola will be like this. God, now Viagra. You know, we should be mindful of what we are watching, of what we are exposing ourselves to. You see people, they will be buying. I was watching one presenter. The person was like, you see my skin is glowing. The cream I use every month, I buy them from Nigeria, 50,000 naira. Do you know the chemical? The person, they white, it won't vanish. The thing with the body, as they talk and they see all. How can you use groundnut water to wash your vagina? That is what Bola Tip is saying. What are you trying to do? I was at Diversity 101 this thing that she was telling me they use alum to tighten their kpekus because the effect of alum on snail. You're just killing yourself. Who do us this thing? Who? Who will offend? We could just come make us dey ignorant like this. Yeah, because you know, Bola. Some people go just say, now when you said what? Because you know that nothing is supposed to go there. And some people go just say, now they go just quickly they copy the ingredient, the recipe, groundnut water, blah, 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 blah. So okay, you start using it to wash your kpekus. For crying out loud. Bola we don't die. If he just be say never die, finish, but he get time to raise. Kpekus where they smell, you can still revive it. Your pussy can still come back to normal smell where it's supposed to be smell. Hi, Mr. Rock, you're welcome. Teeth bacteria is the best ones. It lay eggs in the teeth surrounding it, become brown color. Oh, this boy don't come again. Practice good hygiene. Your vagina will be always sweet. Yeah. Host, I'll be back. My premiere is starting now. Oh my. So sorry, my darling sister, for come. I just start my live stream. You know? When I just saw the video, I was like, what is this? Okay, now you are telling me to come and help you. How I want to help you? How I want to help you? Medical doctor, they don't see the pussy. Say, you not go let them sew. The only thing wey they go just come they do for you now, make they come they treat the kpekus for you. Because the injury is so severe that they cannot do anything about it. As hot as garlic. I tell us, I don't get anything where I want to do. I don't feel do anything. I don't feel do anything. There is nothing I can do. Because now you put yourself for that situation. For doctors to come, they tell you, say, come, they clean your kpekus. And now the kpekus is smelling because of the injury. Eh? I don't understand our people, really. I don't understand our people. This woman no enjoy banana. He not go enjoy banana again. Wetin medical doctor don't tell us say they not go feel so. Wetin he won't do. He cannot do anything now. Wetin he won't do. Me will be ordinary hair bad this thing. He can't give me in wahala. I say me tell you say me na medical doctor. I dey tell you say I be surgeon. I'm not a surgeon. I'm not a medical doctor. I only give tips. Before you go put hole for this thing, go they put for your vagina. You consult me. You don't know my channel. The lady DSTV say he know the lady. I don't want to make sure the woman name. He say he know the lady. When she was teaching it, saying so she just they look, they laugh. Initially she thinks saying a joke. Because of saying a big YouTuber. You can't consult me. You go say, Adam, we get just 2,000 followers. She don't know anything. You not come consult me. When your kpekus don't born and you find me, they come. I not get help where they take the treat kpekus we born. Hello, Austin Divine, you're welcome. Thanks for coming. Thanks for coming. I don't know if you understand me. You did not consult me. They call my live stream, make sure they eat rubber rice. The thing go tight again. And the thing they say the injury where they have private part is very, very big. The doctor said there is nothing they can do about her vagina again. The only thing they can do for her is to come and be washing it for her. You know, as you both they treat injury now. So that is what they want to be doing for her now. The thing is smelling. the acid wey dey the garlic, e just eat am round. E eat that whole round, e come be big sore. So if you fit do that one outside the vagina, can you imagine what it can do to inside of the vagina? Now outside the vagina, na she dey describe to me. So happy weekend, Austin. Thanks for coming. Only God know as inside the vagina go be. For her to describe outside her vagina like that the thing is bringing out water. I don't know if you guys get what I'm trying to say. Please, before I embark on anything, men too, they go tell you now, Fantastic FA, you're welcome. They go tell you now, say, drink this thing overnight, your bladder will be like this. It's a lie. It's a lie. It works. Don't get me wrong. I said it earlier. Bola we don't die. It needs time to raise again. It needs time. Not be magic. Because all those arteries, they are closed. Maybe the blood circulation is not going well, it's not circulating well. So you need that, you need nitric oxide in your system to be pushing it, to be pushing that blood there before it will go reach that your penis area. Don't allow anybody to deceive you to use what will be detrimental to your health. Herbs day. At times, some women, they will tell me they don't want to have children. Make I give them waiting like preventive this thing like contraceptive. Yes, I've got herbs for that, but I don't. Bola we won't rise. Need good blood circulation. Exactly. Then you can go tell me say na one concoction where you prepare. Now you go come make the bola just rise. Now you say. If not that one, I be say all those arteries, they are not there to do anything. Fine, it will work. I'm not saying it doesn't work. It works, but it dey take time. When I'm prescribing all those things, when I talked about EP the other time and what's it called? Erectile dysfunction. I said it. I said all these tips, all these herbs that I'm putting here, don't think that it will work for 1 week. Our body metabolism, they react to things differently. Apart from that, if you suffer any ailment, we be say is reversible. It will take you 90 days upward for everything to be okay. For some people, they pass that 90 days, which is 3 months. If they pass that 90 days. So when you're doing it, just feel saying and continue something. Be like when they go give you medicine and say, okay, you dey anemic or you anemia just they come. Start taking this medicine. They go say take it for 3 to 4 months. Then you go come and see and say na that time until they work. Hey, my darling Tina God, you're welcome. A Fantastic FA. Now one woman, I even saw the video. I saw the video. The woman come dey tell the followers, say make they use clean needle. I don't want to mention the person name because I don't want saga, I don't want wahala. But lady DSTV dey here just now. She say she know who I dey talk of. Maybe una go know am. She can't use needle, put garlic. He say make he followers use needle, make they put am for garlic, make they insert am inside the akpekus. Now anus, nyash. Now I mean no say they insert garlic, not be inside vagina. So the woman because make they insert her overnight. As hot as that thing. If you insert her for anus, because I tell you now before, I say I suffer pie when I was pregnant. Yes, pregnancy they provoke pie. So women here, if you experience a normal thing for pregnant women for pie to come out, because the weight of the baby go relax on some of the nerves. When it be say the circulation go come, they find where it go come pass. So it go come when it go come relax on that. Now so constipation be. When I still tell you, I say constipation they cause pie. So that weight on that rectum region, now it go come make that muscles they protrude out from your anus. So now so it still be when you're carrying a baby. So this woman so when they suffer and then waiting I they do, I will put garlic inside my anus, and when you put the garlic inside your anus, if you even get infection around there, you go dey say, go be like say ants dey even bite you around. It's good because it's your anus. You go dey smell am. Wetin you put for your anus, you go dey, you know, dey belch. You go be like say you eat am. When you dey talk, you go dey come out. Then you come go put FA. Now you I dey explain to, you know. You come go tell them make they put am overnight. When they come break now, the woman vagina come dey melt. It come dey melt. She come dey think say na small thing. He come dey make, she dey treat am small. When she see say the thing don pass, be careful. Now she carry am go hospital. Doctor say nothing they go fit do. Because the way that region take be, they no fit sew am, they no fit hold any skin. The thing just eat am round. Na real Jesus. The thing just eat her vagina round. So the thing wey they tell her, and I make she come dey treat am, you know, they go come dey clean and they treat am. So as that thing sweet reach now, for now, that woman dey suspension. All in the name of say you won't kill infection. What happened to all the things where they talk about for my channel? Now you don't get big injury for your kpekus. Now you come meet Susan Herbati, say wetin you want use take cure am. When you go eat am, I did there. I didn't just want to be harsh on her, but I told her, you come to my channel at times, like you said. You don't ever see me tell una say make una go inside that thing for una anus, una vagina. She said no. I said, wetin surgery no fit do? Help no go fit do am. And the way we both people take they treat their injury here, especially open injury, is different from the way we take they do am our own way. Or they peel injury every day. When you go there, they go see clean and peel am. But our injury, we know they clean. We they put that herb, that medicine, make it a heal am, Now make you go see and say our injury, what would they use herbal medicine till they cure? It they quick the heal past English own. So I they take this one, they tell us now, and they urge us all the time. Now I'm not saying share my video, share what you know. Tell other people. We have YouTube channels. Tell them, this is what I learned from here, and I read about it, and it's true. Don't insult. I say it all the time. Take me to any gynecology in this world. I will say it, and they will say it. You're not supposed to insult. The only thing that is permitted, I say it all the time, to enter your kpekus na gbola. Even your finger is not allowed. Now, say make we just call the totori, we take they use hand. This your finger is not even allowed because of the bacteria where they beneath your fingers. Where you go fit transfer, go enter your vagina. Where you go stay for your pelvic region. It go be the one where you go come they treat PID, pelvic inflammatory disease. Is that what you want for yourself? No, now. We grow up. The fact say the person get thousands of views. It not means all the things where the person put there and real. Not only you go make and read by doing the research yourself. Not only you go make that thing real, say, oh, like seriously, is this how this thing works? Then you will not be doing it. In almost all my video, I say it. The researcher's desk is there. The what's it called again? Medical journal is there. All those researchers, when they go do that research, then they put them there so that me and you know will fall victim. For there you go see different medicine where they go tell you say avoid all this paracetamol, ibuprofen where I tell they sing, all of them there here, they will tell you don't abuse it. If not, you're killing your kidney. You go waka come. One of my wonderful sister, she gave birth 3 days ago. Was it 3 days ago? Yes. She dey come watch me here. She dey come watch me for my Facebook too. She put to birth 3 days ago. Now so she dey call me. Host, I called you, but you didn't answer. But I told you I don't answer that call. If I begin pick that call, my darling sister, Effie, your sister go crazy. The calls are much. The call is too much. That is why I always tell my people, drop a voice note. When I read reach where you dey, I go reply you. If I begin, so that phone is always on silent, and the phone be this, is always on silent. Because person go craze. I be human being, I dey work. I be mother, I be wife. I go come still do house on. Come begin still dey phone. I don't know whether you understand, my darling sister. No vex for me, I beg. Just drop voice notes. I will definitely answer you. Okay? I beg, no vex, okay? You understand? So she don't born. Before she born, now so she go call me, hey, Susan, now so my hand dey weak. I don't feel carry my hand. I don't feel carry my hand up. And now so this one, I don't feel make pounded yam. It be like say blood no dey flow again. Waiting I go eat. Blah 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 blah. That's why I bubble her. She don't born 3 days ago now. Because I tell her, say those pains. Now abnormal thing they happen for your body. Now human being they grow for your body. Your body no fit be the same. But taking all those drugs, it no go help. I tell you, I say recently for Spain here, as they don't they link 1 gram of paracetamol, they are now linking it to so many women giving birth to children where be say they get immature brain. A&A platform, thank you for coming. You know, I was so happy. So when she put her back, when she now this phone now they use, I for play her voice notes to Namona and listen to her. She said, thank you. You were with me right from day one. Because that medicine where you won't take. Now for momentum relief. It's just momentum. It's momentum. You're feeling headache. Try to know why that headache is coming. Don't just go and be pumping in painkiller. That painkiller is just trying to suppress something. I want us to talk one-on-one. You don't want to drop a voice note. Hey, wahala be like bicycle. Oh, God. You want to call that so I can pick it? Hope the talk no go long. If it go long, you know say I did live stream. You want to call me now, FA? May I remove her for silence? May I for pick? If the topic, if the story go long, oh God. He said we want to talk one-on-one. All right, my darling. If you want to come in and let me know. You understand? So when I see people like that testify, try to thank me, you were there, I did this, I'm not doing this because of you. I used to do this before, but now I do this because what you said. You understand? I go dey fulfill, I'll dey happy. Because our officer, one person don't still come off for that lane of abusing painkiller. I don't know if you guys get what I'm trying to say. That woman now, who tell her make you go put garlic for pussy, that one they enjoy bola they go now. She will use eye see, we no investigate. Not be she they one chance, not be she enter one chance so. Now she enter one chance. You understand? So guys, make we dey read wetin we won't put inside our body. Make we dey very, very mindful of wetin we won't do. Man and woman go want sleep. Now so the man go carry spit. He go carry spit, he go dey take and dig the woman. The bad bacteria wey dey your teeth, wey dey your mouth. You are passing them into that woman's vagina. All in the name of say you want to make that place wet. Wetin happen to foreplay? No, tell me what happened to foreplay? What happened to you playing with the woman? You touching her? You stroking her clit? You kissing her? You caressing her boobs? Asking her, where do you want me to touch in your body? How do you want me to help you? Ask her those questions. Talk gently into her ears. All those ones too will make that down there wet. What happened to those ones? No. Wait till I just know not to lie the woman down. Brah. Imana book na your master imana lelaha. sorry, guys. You understand what I'm trying to say? So that is it. It's not too cool. Not be waiting too cool. It will get to a stage in life. People don't need to tell you things to they do. It got to a stage in my life. I just sat down one day. I was like, I'm 45 now. Nobody go fit tell me now. Say make I can't like. Waiting I don't like. I go say I like am at this age. Or waiting I won't do, somebody will talk me out of it. When I say that thing, waiting that person they talk. He get age where you go reach, then go say do this thing. You will sit yourself down and say, hope this person is not carrying me around. Let me investigate. Let me do my research if this thing is okay or not. Are you guys following what I'm saying? It's very, very important. Very, very important. Because at the end of the day, now you go come to suffer the consequences. Go and do your research. Thank God we all can read. Some people go just bring something come out. One was explaining, do this one, do this one. As he explained, the combination was okay. The component of what she did, what she put together was okay. But she no come talk where I for come get problem with her. Yeah, I'm 45. Thank you. I don't dey crawl, they go 46. Before you know, I'll be 50. You know? So, it gets where it go come reach. When you go come, you sit yourself down. As I was saying with that lady just now, all the components, everything she did was okay. But there was one thing I didn't like about her video. She no talk, say, if you dey suffer ulcer, no eat this thing. E no talk am. Because that thing wey she prepared, a very good combination for fibroid. Those women wey dey battle fibroid, especially fibroid wey dey discharge, or fibroid wey don dey block pregnancy, or ovarian cyst. That combination, I will start preparing herbs now on my live stream. Maybe I will start that next month of October. You know, she don't prepare everything finish. I give her like. But I no want comment because she no talk, say that thing no good for people wey get ulcer. Una understand that? As she don't do and finish, if I talk, say, if you dey suffer this thing, no, take am o. If you dey suffer this thing, not take am o. No, he not talk any of those things. He just leave am there. So people wey dey desperate, wey get fibroid problem, they will go and do that thing, and maybe they are battling ulcer too. Una no say ulcer na one kind another bastard wey go dey there. You get to dey careful if na so the injury, before you know you go come turn to bleeding ulcer. Your ulcer go come dey bleed inside you. You get? That was the only thing. So if una come across any concussion like that, especially the one where you won't put inside of you, make sure say you go read them. This thing is good for who get ulcer. This thing is good for who get ulcer. I don't know if you understand. Or this thing is good for who get hypertension. Or this thing is good for who get diabetes. Or this thing is good for who get a fatty liver. Or this thing is good for who they battle kidney problem. You understand? Always ask. If not, any situation, any condition, any medical condition you're battling, that thing will aggravate it. That thing will aggravate it. Exactly. You go say before, even if I did my live stream, I mention research past 10, 20 times. Hey, Juba Bruce, you're welcome. I did mention past 8 times. I'll be telling them, do your research. Herbal medicine, I say it all the time. Herbal medicine is the best. If you want to get things done, if you want that sickness to get treated from the roots, not make them just they treat the surface, herbal medicine is the best. If you want things to get done, embrace herbal medicine. But I always say one thing too on my live stream. If your condition, if what you are battling, it don't pass some level, like when I talk about fibroid, there are some fibroids my Aridan fruits cannot shrink. Fibroid we don't reach 18, 19, 20 centimeters. It's, hey Yagbai, thank you for sharing me out. God bless you. My Haridan fruit and my Negro pepper cannot shrink it for you. Or my curcuma cannot shrink it for you, because that one is as big as baby. But you see all those small ones, we're going to form some kind of blockage for inside womb. We feel shrink all those ones with all this Haridan. And minding what you eat. Herbal medicine is the best. Anything you're suffering from, herbal medicine. Thank you for sharing me out. I saw it, Anna. God bless you. What an amazing singer. Thank you very much for coming. You know, herbal medicine, we treat it from the root. Are you guys getting what I'm saying? So that is just it. If you are Natty Slim, you're welcome. If you're battling any ailment, if you're battling any sickness, of which this day and day everybody get one sickness or one thing where they battle. Fertilizer too much, where would they eat? Chemical too much, where they take the process, what would they eat? Even the air we breathe is not safe anymore. So one person they get one or two things where they battle. Is it that your hormones are not balanced? Or you have some benign tumor you're battling, or maybe you are diabetic, or maybe you are hypertensive, or maybe your liver is fatty because of what you eat. Different sickness where everybody they battle. Some they don't even know they have that sickness. They will just be living with it until one day, boom. You say, hey, what happened? So I didn't know. All of a sudden, that sickness don't dey there. When you see some women, they will just tell them, you have cervical cancer, you have stomach cancer, you have 6 months to live. That cancer don't dey there, tete. Maybe that person, they mistake that cancer for ulcer. Maybe that person has been mistaking that cancer for pie. I told us one certain time that one lady was pressurizing me to give her, because I told her all the herb where I know I don't give her, me she take treat her pie. She was still telling me, and the pie this, the pie that. I was not like, go for a checkup before we consider a cancer of the colon. Now she dey battle all this while. So somebody like that woman, the thing don't dey there for a long time. She even notice and say something is not right, because anytime when she go toilet, now blood she dey shit. They put her on anemia medicine. She was thinking, say na bleeding pie. Some pie they bring blood, some pie not they bring blood. She was thinking it was just bleeding pie, not knowing that it was cancer of the colon. So some people, they don't even know what they have. They don't even know what they are battling. So that time again, I talk about checkup. It's very, very vital. It's very, very important. You get yourself checked. I did mess also mess. Not be waiting normal. It might be that something is wrong with your colon. If you just be say it's still normal, but go and get it checked. Some people just anytime they eat, like one lady that left a message for me, which they hear. Say anytime if na small food she just eat, her belly go just food go just tight. Now say you get ulcer. And when she dey talk, she get this harsh voice, like these people when they go be like say that kind of voice. She said her voice wasn't like that before. When I tell her say ulcer fit cause, I say madam, you really know what you dey talk. say she gets all these things. She not even know say that the ulcer na it cause that this thing. Are you guys getting it? Get it checked. When you see that something is wrong, is not wrong. What am I trying to say in all these things that I'm saying? Try to listen to your body when your body is talking. Our body don't get mouth to talk. The only thing they do to us is, the only thing they do is to give us those signs that things are not going well. And your responsibility is to listen to them when they are talking. All of a sudden, your mouth not the smell before you can't smell anyhow. What's wrong with my gut system? Get it checked. No be big deal. Gut system with spice and a few other things. With tea, you can even clear your guts. It's like I'm not breathing well. Is my liver okay? Okay, let me just detox. Clean your vital organs. Clean your system. You dey, your anus dey always scratch you. The worm. The worm. No say that worm dey scratch you there. Some no be worm though. Pie dey scratch too. Are you guys getting it? So guys, don't just think, okay, my liver go. No, you go come dey big. You go come dey big. This swap I dey talk about, well, women they do every 3 years. A lot of women they don't do it. It's to prevent cancer of the pelvic, some cancer of the womb, of the uterus. Yes, go and do it. It will not cost you anything. We women, our body they absorb well. We talk am all the time. Some infections can be in our body for a decade. That's 10 years. Oh, thank you very much, Bola. Thank you for sharing me, and God bless you, sis. Have a wonderful night rest. I will soon round up now because I'm going live on Facebook. Thank you very much. I don't notice my phone off, so I won't use the tool. The phone where I think they go live for Facebook already off. So when I finish here, I'm going to Facebook, so I will not be long. In 1 hour, I should be done here. You know, do it. Just you don't necessarily mean to be sick to go to the hospital. No. Get yourself checked. What is this? What is that? I told you about 3 months ago, I went for checkup. I went for checkup just to see how my hormones, I talk am here all the time. Now hormone wahala and I be my own cortisol. If you see me at times, you think I'm pregnant because the cortisol is high. At times, if you even see me, you think say, where the belly where I see last 2 months. Are you guys getting it? Get all those things checked before you go come turn to big wahala where you go come be say you come define how you want to take care of, you know, go fit care of. You know, guys, and be mindful of what you do in the internet. Don't do it because you see say people get a lot of views there. You can't go do it. No, it's not advisable. Do your things. Don't allow anybody to tell you otherwise. Do your things. Do it because you want to do it. Do it because you've read about it that is good for you. That is why you're doing it. Don't do it because you see many views. Everybody just they watch this person. No. If you be say 1,000 people will watch that thing, they no go even do wetin that woman say make they do. Another 500 people will watch the thing. They feel even just watch am for fun. Then the rest percentage will remain, and then we'll go do am. And this percentage of people will still do am so, no be all the thing will still affect you. No be all the thing will still affect. Because of our body mechanism, our body metabolism is different. is totally different. Are you guys getting it? It's different. The fact say I do am, the fact say that girl do am now, she did that condition. Not be only she do am. A lot of people do that thing, which we can put her for that condition. So you're surprised say na only she. Hey, talk with Richie. Thank you for coming. You're surprised say all of them do that thing, but na only she can do am. Hey, Rosie Lawson, you're welcome. You're surprised that not only she can do am, her own case can different. So that is what I always say. The fact that A is doing it, it not affect A, doesn't mean that when B is going to do it, it will not affect B. It will affect B too. Believe me, you, that lady where that thing happened to, not be only she do am. But now she dey suffer the consequences. If it be say others still do am, and only she cry out, and it was because she cried to me, na even make me know. Maybe I for not even know say she dey carry that kind injury dey waka for kpekus. If you see her, I didn't want her to send me the picture because I don't want come dey get nightmare. Ordinary some pictures where I go see where what go dey pussy. At times I no go fit eat because no be my feed. Now just research I go do, can't give una information. I no go fit eat. But with the way she described her kpekus, for doctor to come say they cannot, there is nothing they can do, you will know that that place is no go area. Automatically you don't send your husband, make your husband go deflate, because toto will not get injury, will not get sore. It hard to penetrate at times. How much more down we just can't melt. You know what it is for skin to melt? One thing an injury, you know, say person tear body like this, then go feel so. But when it's melting off, you cannot hold it, you cannot sew it. So her vagina is melting out. You're just surprised now say she even get diabetes. She don't know. Because she say it leak, it bring water, it melt. When you are cleaning the skin. You see what she calls for her own self, for her vagina. So my people, not be everything wanna see for internet to go they follow. A lot of them are okay. A lot of them they won't view. Some people you go even see the thumbnail, the topic of their video. You go run enter inside. Wait till they talk go different from the topic. Just because they want you to get the view. They want to get the view, I mean. It will be different from what they're talking about. So now say your health not really concern them. Now their view na matter to them. And you na be the victim, not be them. They don't put their video there. And when you go see them, after the woman don't do that video that day, I can't go her description box. She can't go right for the description box. She can't say, you know now, for my own description box, I will tell you what I'm talking about, blah, 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 blah. Then for that, I can't talk, say I not be medical doctor, and I just research, I go do stuff like that. Now we write. Wait till she write for her own, we say, anything will happen to you, where you use for the in channel. I don't want to mention the channel name, Lady DSTV. I don't know whether she's still there. She said she know the lady. She said anything where you see, say now our channel before do the thing, if the thing come backfire, he say it's at your own risk. You get her? It's at your own risk. For to tell them say make them go do research, if they tell them say na their own risk, they take do that concussion wey born person kpekus. I beg my darling people, I think I don't do 1 hour now. Yeah, it's 55 minutes. I don't want to do past 1 hour because I have to make my video and I have to go live on Facebook. Okay, my people, I'll be dropping my video tomorrow for now. So make una watch out for me and leave beautiful comments for me. I love you all, and please guys, Nariha, now wow. Now wow, now waiting we see you. She called me to tell me what she can do to revive Akpekus. I'm not a medical doctor. I tell her, and she say she dey wash me. If you dey wash me, you still can't go for that kind of victim. It means say now all those kind of people where they make somebody dey feel say what you are what I'm talking na rubbish, or this woman don't know what she dey talk. Because she say she dey wash me. If you dey wash me, she forgot type whether if in leave garlic inside vagina for throughout the night, whether e good, e for go ask. Make they tell am say na no, e no go ask, and you dey come Susan Herbatives. Na im make me dey tell una the day where I do that, where I drop my video where I talk about pile. I talk am. I say na anus, so I no tell una vagina o, because I know some people. They go say Susan Herbatives talk say insert. They no go listen to hear where I say make they insert the thing put. They will go dey insert am for their Akpekus. Meanwhile, they no wait make I talk whether na Akpekus or na anus. They no go wait. They just hear insert. She say no insert something. Oh goodness me. I don't feel laugh. I beg my beautiful people. I love you all. Oh. People can try your things. Now because you know, make you call her your things now. It's because you know. A lady told me that he get one this thing where she use. I don't know what she say she use again. He say he be use and make Akpekus for tight. He say now Akpekus come dey get funny odor. Now I tell her say, if na wetin you use your hand cause, if na normal infection, go watch my video on discharge, go watch my video on smelly Akpekus. That is all I can give to you. If na you don't go use your hand, they carry a foul smell come your pussy. Now you know. He say if you and a boyfriend, a husband, that be boyfriend or a husband, I don't know whether na boyfriend or husband. If he just the man go they do. You understand? Man go the F you go carry nose go the other side. They do wetin they do because of the smell when they come out down there. I beg my people, I don't want to do past 1 hour. I will see you now very soon. I will see you guys on I will see you guys on Saturday. That's tomorrow. I'm coming live again tomorrow. I'm coming live again tomorrow, okay? I'll see you all right from young age. I don't experiment my body. That's very nice. That's very nice of you. Thank you, my darling. I'll come live again tomorrow, Saturday. I'll see you all. I love you all. Bye.